So today we'll talk about the Omicron. So there was first question it comes into the mind. What are the symptoms of Omicron? Either we say that Omicron COVID-19. So Omicron COVID-19 symptoms are, as per the studies which has been shown, the symptoms are same as of Alpha, Delta and Omicron variants. But there is something which is like severity. So most common symptoms are the five symptoms. They are running nose, then headache, easy fatigability, might be milder forms or might be severe form, then sneezing and sore throat. So these are the main five symptoms which are of the COVID-19 virus. Either we say COVID-19 virus, either we say as a alpha, beta or alpha, delta or Omicron variants. But some patients may have fever, more tiredness, loss of smell and sense. These are the things which will be seen in the severe cases, in delta cases also, and in early symptoms of Omicron where it is tested within 3 days. And the milder symptoms or lesser symptoms of this Omicron are sore throat, headache, body ache, diarrhea, rash over the skin, some discoloration of the fingers of and toes, and some irritation in the eyes or redness of eyes. So these are the lesser symptoms which are seen in the Omicron. While some serious symptoms also can be seen in these cases, like other COVID variants, like associated with difficulty in breathing, shortness of breath, loss of speech and mobility, or confusion and chest pain, and may patient land into ICU. So these are the serious symptoms. So there are no differentiation factors for alpha, delta or Omicron. There are similar, only the severity will judge the symptoms. So the next question arises, is Omicron mild? So we say it is milder form because the symptoms are slightly milder than Delta virus as compared to Delta virus, but the symptoms are similar to Alpha and Delta. So though it is said as a milder form, but the overall transmissibility of the virus is very high, and that is the main cause of concern. If we see in a delta virus, there was out of 45 to 15% of population was infected, and out of that 15 to 20% of patients were likely to get admitted in ICUs and hospitals. But here the transmissibility is very high. So it is like we have seen in weeks that it is more than lakhs of the patients are coming, and so only if it is 5 or 10% of these patients are get admitted, still it will be the higher number of the patients which are admitted in delta virus. So when the peak will be there, approximate, all of the societies have said that there will be peak of more than 9 lakhs to 10 lakhs and maybe 14 lakhs also. But if we take in 5% of the cases which will get admitted, so there will be the scarcity of the beds, and that will be the more major concern for this Omicron. Though it is said as a milder form, though it is having the milder symptoms, but there are patients who are having comorbid conditions and other conditions which may get land up in ICU and ventilatory support in this patient, and that may also rise in future when there is peak. So we should not miss this or directly say that it is a milder form of disease or other things. So as the cases will increase day by day, the health services will face the demand of Omicron cases will grow regarding its beds and drug scarcity. So we should not miss it. Now the third question arises is, what should be the precautions? Similarly in the family as well as in the persons. So same precautions are advisable, which has been given by the WHO and the health departments of India. So avoid crowded places, confine to some they should not confine to some enclosed place where there is poor ventilation. So try to practice the physical distances, like keeping the distance more than 1 meter from yourself to others. Second, wear a mask. So mask is very much of compulsion. We have seen that even if patients and person who is taking wearing N95 mask, so the transferability increases by 25 hours. So the mask is the major thing which can prevent you from occurring this disease. Third is wash your hands frequently wash your hand with soap or keep sanitizer and keep the hands clean so that you can fight with the COVID-19 virus. Fourth, keep all the spaces well ventilated. Wherever you are lying, sitting, so that spaces should be well ventilated. They should not be in the closed space so that the transmissibility may increase. Now, while coughing and sneezing, you should always use your elbows, or you can sneeze directly into the tissue and it should be discarded. So that is the major thing which we can protect from the infecting others. Now, fourth thing is last, you should always disinfectant your surfaces like mobile, your desk, your surfaces wherever you are touching, wherever the patients are touching. So that should be cleaned with sanitizer. And last precaution is take early medical care. Whenever your patient is having fever, cough, or difficulty in breathing, or any symptoms of COVID-19, they should consult a physician uh, as early as possible, and they should be evaluated for the disease. And the last thing is now regarding the precautionary dose of vaccine, so that should be taken by the healthcare persons or the person who are coming in contact with the in healthcare services, and a person who are having comorbid conditions like diabetes, some immunological diseases, some patients who are on immunosuppressants like patients who are on cancer drugs, they should be taken as a precautionary dose for the COVID vaccine, that is booster dose, whatever we say. So this should we should follow to reduce the transmission, to reduce the disease of the state, and early diagnosis and early treatment is most mandatory in these cases. Thank you.